My name is Dr. Andy Reid. I'm one of the sport medicine physicians here at Banff Sport Medicine, and I'm going to go through some of the things to consider when you're having a platelet-rich plasma injection.
Take it easy for the next 2 days.
PRP or platelet-rich plasma injections are one of the newer options to help treat arthritic joints or tendon and ligament injuries. When we do a PRP injection, we take a sample of the patient's blood. Typically, we're using quite a high volume of blood, so we'll take 40 to 50 cc's of blood from your arm. This is just like having a blood test. We then spin the blood in a special container in our centrifuge, and we typically do 2 spins, and then what we get out at the end is a concentrated mix of your platelets and sometimes your white blood cells, depending on what we're injecting. Why do we do this? Well, platelets are little blood clotting factors whose regular job in life is to plug holes in blood vessels and then to release growth factors into the damaged blood vessel to heal it and to stop the bleeding. When we inject platelets around an injured joint or into an injured tendon or ligament, the platelets will stick to the damaged area, and once they stick there, they release a series of growth factors which can promote a healing response. Platelet-rich plasma injections are generally very safe and well tolerated. It is common when you have a tendon or ligament injection, however, to experience some temporary increase in your pain and sometimes some swelling. In some cases, the increase in symptoms can be quite marked, and we will actually get some of our patients to protect the area either in a sling or in a splint or in a brace. And occasionally we put patients who are having a lower limb injection on crutches for a week or two while they get over that initial temporary flare. Platelet-rich plasma injections really have no long-term negative effects on our tissues. We're using the patient's own cells to promote a healing response, so generally these are very well tolerated, and things like allergic reactions are quite uncommon. Because we're relying upon a biological action and the release of growth factors into the tissue to promote healing, the onset of action can take some time. Some patients do start to experience benefits within about 2 weeks, but I would say in general, most patients are not feeling a ton of benefit until about the 6-week point. But we know that full onset of action and full benefit can take up to 6 months. The cost of PRP is higher than with some of our other injections, and this is largely due to the cost of the equipment that we use and because of the time that it takes. The whole procedure takes about 45 minutes, so there are costs associated with that. For a PRP injection, costs range from $500 to $600 depending on which kit we need to use and how many sites we're injecting. Unfortunately, PRP is commonly not covered by insurance, although in some rare cases it is. I recommend that you check with your insurance company, but oftentimes it isn't, and this seems to be because it isn't a pharmaceutical, it's more of a procedure. If you're coming in for a PRP injection, we like you to refrain from taking any non-steroidal anti-inflammatories for 1 to 2 weeks prior to the injection. And then after the injection, we also like you to refrain from using these same drugs for 1 to 2 weeks. The reason for this is that anti-inflammatories can affect the function of platelets, which we don't want to do. Prior to your PRP injection, aside from avoiding NSAIDs, there are some other additional recommendations that I like to implement. There is some suggestion that light activity immediately before the injection can increase platelet counts. So I often have my patients do some light exercise immediately prior to the injection. It's important if you're taking blood thinners to mention these to your physician as well, as this may affect the effectiveness of the injection. And sometimes with some injections, we like you to stop blood thinners ahead of time. Your physician can confirm this one way or the other. After the injection, we recommend 72 hours of rest to allow the platelets to adhere to the injury site and to do their thing. When we inject the joint, typically I have patients rest for 3 days. They can ice the area. They can use Tylenol if they have an aggravation of their pain. And after this, you can resume some light activity and slowly ease back into normal sports and activities. With tendons and ligaments, there's sometimes a more specific protocol. And just for example, oftentimes if I'm doing a tendon injection, I'll have the patient rest the area completely for 1 week. At week 2, they'll usually start some light range of motion exercises, and by week 3, they can typically resume some light resistance training with bands or light weights. And then usually by about week 4, we can resume full training. The risk of infection after a PRP injection is actually very low. This is because a lot of our PRP preparations contain white blood cells, and in fact, in some instances, physicians will actually use PRP to help treat infections. So the risk is really very low. But if you should experience dramatic swelling and a severe increase in pain with redness and warmth or any discharge from the infection site, then it is important to have an infection ruled out. So please contact your sport medicine doctor if that occurs. If you've had a PRP injection and you're not noticing benefit, then it is a good idea to follow up with your physician. Typically, I will see my patients at about the 6-week point. Most patients are starting to notice some improvement, although full improvement can take between 3 and 6 months. PRP injections can be repeated at any interval, depending on the response. So sometimes at that 6-week visit or the 3-month visit, we'll recommend that you schedule a second PRP injection.